Hello, and welcome to Drug Talk. Today we're talking about Dexilant, how it works in the human body, what sort of errors can be made with taking Dexilant, the consequences of those errors, and what you should do if you are feeling those consequences. My name is Matt Hamilton. I'm a drug error trial attorney, and I'm joined today by Dr. Jesse Garcia. Welcome, Dr. Garcia.
How are you doing?
Sir, what is your area of specialty?
Well, Matt, I am a clinical pharmacist. I specialize in drug interactions and the effects on the human body.
Dexilant, am I pronouncing that right?
You are.
What does Dexilant do?
Dexilant is in a class of drugs called proton pump inhibitors. They basically shut off the decrease the amount of acid that's produced and thus secreted into the stomach.
Why would somebody be taking Dexilant?
Patients would be taking Dexilant if they are suffering from cases of either heartburn or some type of ulceration is typically what we'd see.
What sort of errors can be made with getting Dexilant into the body?
Well, Dexilant has to be taken in a certain manner in terms of the timing of it. So it needs to be taken between 30 minutes and an hour prior to the first meal of the day is typically when we would do that. And that's just because we want to keep the pumps shut off in lieu of then you've eaten, the pumps are now producing acid, and then you take it and then you try to shut it off and make it a lot more difficult to work.
So you want an empty stomach at least 30 minutes before eating?
Minimum of 30 minutes.
And not take it after you eat?
Absolutely not.
Okay, all right. And how long should they wait? I mean, is there a time to be taken too long before a meal?
Well, no. I mean, you're looking at 30 minutes to an hour. I mean, the potential is that your dose would potentially be increased, meaning you go to the physician's office and he says, how's it working? You're taking it with the meal instead of before the meal. You're going to not have as good of effects, and so you'd basically say, it's not working for me. So your dose would most likely increase.
Are there any dosing problems, say, from the physician or from the pharmacist with this particular drug?
In some cases, yes. You're looking at different specific doses of the medication. So say you're trying to get to a 60 milligram dose. That's your intended target. And it comes in 30 milligrams. So you could take 2 to equal 60. Except in this case, this medication is not designed to be able to do that. It's designed to be able and has a release mechanism that prevents you from getting the same results with 230 milligram capsules as opposed to 160 milligram capsules. So the dosing is important.
So your medical professional, if he does that, that's wrong.
Yeah, because if the intended dose is 60, you won't get the same results as if you were just using a 60 milligram.
Gotcha. Are there any laboratory issues with respect to Dexilant? In
terms of analysis, there are some issues that with a lab value called chromogranin A, which is basically the nickname is CGA. Okay. Is that's the basically the marker for it, and that can basically be influenced by the levels of acid, specifically with Dexilant. And so you can get some false positives with that because the normal levels are lower, and so the acid basically can cause the lowering in the acid can cause higher levels of this, and higher levels of this CGA can result in a false positive in some cases.
Can you take this drug too long? Dexilant, can I take it for too long of a period of time?
For a length of time, yes. We can see patients that begin to use it almost as a maintenance drug instead of treating what the initial problem is, be it diet-related, too much coffee, too much acidic food. Instead of treating that, we're using this to kind of treat the bad diet, so to speak.
Is there an outside period of time that's taking it for too long?
I would say at a max, my recommendation would be no more than 90 days, would probably be about the max. I mean, in some cases you can use it longer than that, but within a 90-day time frame, you should have corrected the initial problem.
I see.
And then stop taking it, because taking it for longer periods of time obviously have additional risks that you don't need to have.
Are there any drug interaction problems with this?
There are drug interaction problems with Dexilant, specifically when you're looking at drug-drug interactions. You can have direct, so you can't take drug A when you have drug B. Okay. The other problem you have is you may have some indirect effects. So if you are lowering the levels of acidity or you're not as acidic in the stomach, your body no longer has the ability to absorb other drugs or vitamins in the manner in which it was intended to do so. And in fact, in some cases, in the use of some medications, they're designed to be used at a specific pH level within the stomach. And when you start modifying that level, you start to affect the ability of that drug to either function as it was intended, or it may function more, or it may function less.
I see. So we've got drug interaction problems and consequences with Dexilant. What other sort of consequences can be made from these drug errors?
In terms of what are resulting factors of you taking those?
Yeah, like can there be an infection issue with this?
Correct. Yeah, we see a class-wide notice that went out in the literature in 2016 that we've seen increased levels of C. diff in patients that are on these proton pump inhibitors. So C. diff is basically an infection within the GI tract that results in pretty foul-smelling diarrhea that is highly contagious and can be spread very, very easily. Untreated, it can lead to a condition known as toxic megacolon, which is basically ulceration and deterioration of the GI tract.
Okay. How serious of an infection is that?
It is very serious, requires hospitalization. It requires almost like a decontamination chamber, basically. You scrub in to go in, you're gowned up, and then when you come back out, you'll have to get basically scrubbed down to when you come back out.
Dexilant, can it have any kidney ramifications?
Correct. What we see is because of the way that the drug works, and it's affecting the acidity of the stomach, therefore absorption of nutrients. Sometimes we see a condition called interstitial nephritis, which is basically the inner tubules of the kidneys that become inflamed and irritated. Untreated could potentially lead to chronic kidney disease. That untreated will eventually lead to end-stage renal disease.
If there's a drug error with Dexilant, can it have an effect on the blood or any clotting?
Correct. So that goes more in line with the drug interactions that we had spoke of earlier. In some cases, it can directly affect the drugs themselves, or it might affect the ability for that active metabolite. So in some cases, you need the drug to be at a certain, or the stomach needs to be at a certain pH level for the drug to activate. Sometimes you take, although you're taking a tablet and you think there's a drug in there, that drug is actually inactive, and the body then activates it when it is around acid. So you take the drug, it's inactive, it goes to the acid creates the chemical reaction, and the drug becomes an active drug.
How do you know if you've got a blood clotting problem related to a Dexilant error?
Well, what you would see in terms of that is you might want to make sure that you're getting those medications at the same place. So if you're getting Dexilant, you're getting a clotting medication, you'd want to make sure that you're getting those at the same place so we can do those checks before the medication is released. Obviously, we're not going to let you leave the pharmacy with a medication that is going to potentially have problems for you, especially clotting medication.
And if you've got a clotting area, what, are you just seeing blood on your body?
Clotting, you might be looking at blood in your stool. You might see nosebleeds. You might see big bruises. Those are some of the side effects that we might see.
Well, let's say a Dexilant error has happened and you're seeing blood in your stool, or you've got a serious infection like C. diff. What should the person do?
C. diff, kidney infections, blood in places it shouldn't be are definitely cases where you want to go and get seen. And that's not something you want to wait until tomorrow, not next week. You want to get seen immediately. Tell them the medications you're on, especially if you're on blood thinners. You definitely want to speak with the an emergent doc on that.
Right away, don't wait a few days, don't wait a week.
Nope.
Okay, all right. Well, we've been talking about Dexilant. Dr. Garcia, thank you.
Thank you.
If you want additional information, I direct you to our website, worldwideweb.law-kc.com, and also check out our YouTube channel for additional videos. This has been Drug Error Talk. I'm Matt Hamilton. Dr. Garcia, thank you.
Thank you, man.